Hey, everybody. So welcome to the podcast. This podcast is with Dr. Steve Brown, who's been an orthopedic surgeon for 36 years. Currently, Steve is battling a diagnosis of multiple myeloma. Steve has had an incredible passion for his career and really just a passion for life before his diagnosis and after his diagnosis. I was really excited for this podcast. At the beginning, Matt had just met Steve for the first time, and very quickly, Steve treated him like they'd been best friends for years. And I actually had to tell them to shut up so we could stop and hit record because we were missing too much good stuff. And at the end of the podcast, Matt texted me 3 simple words. That was awesome. It's really a good podcast. I hope everybody will give it a listen. And what I really want you to do is if you know somebody who's considering a career in medicine, somebody who is having a career in medicine, I hope you will forward that to them. It is a great reminder of having a passion for what you do, not just for medical professionals or students who are planning on becoming medical professionals, but really for anybody who wants to have a passion for what they do. So give it a listen. And as always, thanks for listening. All right, everybody. So welcome to House Calls, the podcast. Tonight is our 17th episode? Or
17th.
17th episode. And we are interviewing Dr. Steve Brown, who has been an orthopedic surgeon in the Annapolis area for, what, Steve, 30 years?
36 years.
36 years. And there's a reason why he's the first orthopedic surgeon that we have interviewed to actually discuss medicine and orthopedics. We interviewed the pickleball pioneer, Brian Klepper, but that was mostly about pickleball. And the reason I thought of this is Steve is a sports medicine specialist. I have a subspecialty in hand surgery, so I see a lot of Steve's patients, and they uniformly love him. And so I want to get into a little bit about what he does that his patients love him, but also he loves his job. He loves being an orthopedic surgeon. I want to get into a little bit of that. So first, Matt wants to say something about our sponsors.
Oh, yeah. First off, Steve, thanks for joining us today. It's nice to talk to
great to meet you.
An educated doctor that actually works in Anne Arundel County. I surround myself with not the best or the brightest. But so, yeah, I'm glad you've changed that. But no, we do have a new sponsor today. Pretty excited. I got a nice little care package from our new sponsor. It's they grow it themselves. They have a farm. Got a little baggie. I don't know if I don't know where everybody is. I don't know if this is actually street legal, but I got a nice little baggie for some homegrown good stuff, if you know what I mean, from my friends out in Colorado and the Creekside Farms. I'd like to give a little shout out to them kicking in my licorice addiction. This is the real. This isn't Twizzler. This isn't store-bought. I think they grow it on their farm out there. I mean, this is, Steve, I love licorice, and our new sponsor.
Shoelaces there. You got shoelaces.
Oh, yeah, that's real deal. I mean, it's almost as good as your mustache. But anyhow, so yeah, thank you to Creekside Farms and our listeners out in Colorado. Quick shout out to them. Hey, so Steve, so Ty was telling us that you are orthopedic sports doctor. Why do they have to go to Ty? Because I already think you'd probably be a better doctor than Ty. So explain to me how that relationship works.
Well, I just send them the really neurotic patients, and that way I keep the really good hot ones. Yeah, so with the ones I send to Ty, even though sports, I do a lot of upper extremity, there's a lot of really specialized hand surgeries that are better in the hands of somebody that does it all the time. I'm a big believer in medicine that if somebody does something 1 or 2% better than me, even 1 or 2%, they need to go to that person. And Ty is a really excellent surgeon. In fact, I let him do my surgery.
All right, we'll cut it out. Anyhow, so Steve, let's move on.
So a lot of things, I mean, I have a big practice, so I diagnose a lot of interesting things, but they're better off in the hands of somebody that does hand surgery all the time.
Got it.
And so I send and some hand stuff I still did, which was carpal tunnel, things like that. But a lot of the really intricate stuff, like, I would send to Ty, and he took great care of them, and they loved him. So that was good.
So let's back it up a little bit. I kind of want to know, like, how did you get into medicine? I know your older brother's a lawyer. Was that something you always dreamed of, or how did that work?
It's funny because, there's no medical docs anywhere in our family. My uncle was a pharmacist, but that's as close as we got, and not even nurses. My wife's a nurse, as it turns out. But so what happened was that I was in sixth grade at Tyler Heights Elementary School, which was the best school in the county. And now it's like a really horrible school, but it was over in Eastport, Annapolis. And you know how in the county sends supervisors around to evaluate teachers. And so the person from the board of education came, and I was given a talk, believe it or not, on the musculoskeletal system.
It's sixth grade.
So, in sixth grade,
Okay.
which is kind of funny, really. So I drew a picture of what the body would look like without bone or muscle, a lot like what I look like now. And so at the end of the talk, the woman from the county said, you speak really well. You should be a lawyer when you grow up. And I said, no, my brother Sam's going to be a lawyer. I'm going to be a doctor. And it's the first time that I ever remember talking about it or whatever. And the talk was on, basically orthopedic surgery. So it's kind of odd when you think about it. But I really view, medicine as a calling. It's something we just fall into, where I really always loved anatomy, and you tend to be inquisitive. And I think when 9/11 happened, you saw a lot of people flee into medicine from other careers because they felt it was safe financially as a future. And so you saw a change in the kind of people that were practicing medicine, really, and kids that were going to med school in 2005, 2000, the early 2000s. It was less of a calling for a lot of them and more of a business decision. Whereas when Ty and I went to med school, it was a calling for all the people. And the people I went to med school with, I went to University of Virginia for undergraduate and medical school. I was out of state, so I was here in Annapolis, and then I did my internship in Pittsburgh and my residency at GW. And the people I went to med school with were the finest people I'd ever met. And a lot of them were religion majors and philosophy majors. And, at UVA, they took a cross-section of people because you need a different kind of person to be a pathologist who sits in front of a microscope versus a hand surgeon like Ty, or a radiologist who doesn't really want to see patients, or an OBGYN that deals with, females and babies all the time. So, and those people really, they all were incredibly successful. One of my buddies became head of the American College of Cardiologists. Another guy they're all over the place, but they had a couple things in common. They had great kindness, they had great goodness in them, and they were really, really smart people that could think. And so it just kind of, as you go along, you get out of high school, you go to college, I majored in biology. And then I volunteered in the ICU and did stuff like that when you're in college. And then I was out a year. I wasn't really ready to go to med school right away when I got out of college. I don't know why. I just didn't feel like it. When I took a job at NIH, I was doing breast cancer.
Steve, were you a ski lift operator after college before you went to med school? Oh, sorry, that's another doctor.
That's
Anyhow.
what I did. That's what you did, I assume.
Yeah.
So I worked at a bar during the night at Annapolis called Mum's, which was the big hot place to go. And
Yeah.
It's now dockside. And then, during the day, I did breast cancer research at the National Cancer Institute at NIH. So it was kind of interesting. Then I was ready to go back to school. And so I went back to school in the 80s. So I was out of school a year. And so that's how I kind of fell into it. But it always just seemed like what I was going to do.
So
with no influence from anybody else. My dad was a music teacher. He's like, you can do whatever you want, but you can't be a teacher because he thought the life was hard.
So you went from Annapolis High School to UVA to GW for med school, right?
No, UVA for undergrad and med school.
Okay.
And then I went to Pittsburgh for my internship, and then GW for my residency.
Okay. Did you have an interest in sports along the way, or orthopedics along the way?
Well, it's funny because when I had always thought I'd be either an orthopedist or a pediatrician. Well, you get to med school and you realize being a pediatrician is a lot of it's not as active as orthopedics. Let's put it that way. And then, the other things I really liked, OBGYN was great fun because you got to deliver a lot of kids, which is a really exciting thing to do.
Yeah.
And then urology had really cool surgeries, and now it's all scope. But then it was lots of staghorn calculi, big stones and stuff. But the thing that drew me to orthopedics was, one, I was hurt all the time. I played baseball in college just for a year, and then I left after that because I wasn't really enjoying it. But I had a lot of injuries, so I knew a lot of docs. And then with orthopedics, you get all ages, you get both sexes, and you have people that are injured, not sick. So you're not dealing with death a lot, and you're giving people their life back. And when you give somebody their life back, they are so appreciative, and they get such joy from it, and you get joy from it because you're taking somebody that can't do anything, giving them their life, and then you know what they say. People forget what you say, but they never forget how you make them feel. And when you get somebody better and let them return to what they had before, they love you till the end of time. And that's a really nice thing, And then with orthopedics, it led to a lot of really interesting things that I got to do in my life with sports and teams and actually getting in the music industry. It's a lot of stuff I can go into later, but that's why I really wound up in orthopedics. And the thing is, when you're in med school, they tell you, be careful because you do electives your fourth year and your third year. And be careful you're not choosing the specialty because you just happen to like the guys that are in it or the women that are in it, and that it's something you really enjoy doing. Well, it was both. The people that were in orthopedics tended to be much more fun, very open, and people that tended to enjoy life, and the glass was always half full. And the work was really interesting, and it opened a lot of doors with the kind of people in life where you can make a difference.
Did you know that you liked the surgery part right away?
Well, I will tell you, when I did my internship in Pittsburgh, as interns, a lot of places you don't do a lot as an intern. You draw blood and you set up IVs. Well, I did it in Pittsburgh as an intern. On heart bypasses, I opened up the chest, I harvested the vein, and I did the proximal anastomoses on heart bypasses. So my internship year, I was operating every day because we had an IV team and we had a blood draw team. So at the end of that first year, you had real skills. And so it was really fun because you felt so comfortable doing things. So for me, the learning curve going from an internship to residency so internship is your first year of training. Residency is when you're doing your specialty. And that's what orthopedics was for me. So a lot of these guys, like a bunch of my buddies that did orthopedics at other places, they'd never been in an OR even their first year. And so when they got to be residents, they had to learn a lot of skills. Well, we already had those skills mastered. And so we were able to move on and progress really fast. And so the OR, a lot of people find it hard because of blood and other things. But, when you're operating, as Ty well knows, you isolate the area you're working on. It's much like when you have the cadaver, you're in your anatomy lab, everything's wrapped up and you're looking at a certain area so you can focus. And it doesn't really, we don't, mostly in orthopedics, we do bloodless surgery except for total joints. And so I think the surgery part was always fun. You have a team, there's a lot of bantering, and it's a very collegial environment to be in. And so I always love the surgery part. Yeah, it's fun to do that kind of stuff.
Were you always a people person, like even when you were younger, or like, so basically like you had that component where you were going to be good with patients? Was that natural, or is that something you had to work on?
So my parents, throughout our whole life, my parents were very, very open and affable people. And there were always people living in our house. Because people, relatives or whatever that would need stuff, they'd come stay with us. And so our parents made all four of us. I have two brothers and a sister, and we're all pretty gregarious. I don't want to say affable because that sounds very self-serving, but we do have a lot of people skills. And at 10, 11 years old, we were performing on stage up and down the East Coast singing. And so,
whoa. You can't You can't throw in a Partridge Family reference and keep on trucking past it.
So,
So wait, how do you go from sixth grade talking about cadavers to working the cat skills? What's going on in this?
Well, he's asking me how we got to be so affable and good with people. And so my dad was a music teacher, and he used to sing in New York before they had TV in New York City and stuff, so he'd perform in the clubs. And we're all violinists in my family. All of us are violinists. And then other people like Sam played clarinet, guitar, and violin. George played French horn, trumpet, and he didn't play violin. And then guitar. And then my sister sang and was an amazing violinist. And my mom played piano and accordion, and my dad played everything. And so on weekends, when we were kids, on Friday and Saturday night, all these musicians would come to our house, and there'd be these little, people perform and stuff all night long, right? Well, then we were singing at a very young age. And then we started out doing little fashion shows at like Woodward and Lothrop or something like that. And we'd sing for like 20 minutes or a half hour, and they'd give us $300, which was a lot of money in 1969. And so then we wound up singing in Atlanta and Boston and New York and
I've never seen Ty so jealous in my life right now. Yeah. I can see it. I can just see Ty's dad playing the banjo and Ty playing the cymbals or the triangle. Anyhow.
So, you get to be, when you're on stage, you learn other people's skills as well. So there were always people in and out of our house.
Real quick. So you're 10, 11, and any fear, going up on stage?
I was always, always.
Yeah, okay.
I remember we were singing in Boston. I was like 13, and some girl came up and tried to talk to me. And I'm like, okay, what do I do now? It's like I was scared to death of her for some reason. But we had, what
kind of music were you playing?
And we play all kinds of stuff. We do Peter, because it was folk, it was regular guitars, not electric guitars. And my brother and sister had a rock and roll band too, so they had electric guitars and all that. But so we do cool. Peter, Paul, and Mary, or we do other stuff like that, which was really big then. Or I did Elton John. Like the first song I ever performed was Tiny Dancer, basically, or one of the first ones.
Ty's crying right now.
So we would do all that, and then we grew up in like a little 980 square foot house in Eastport. But we kind of knew everybody, and so every year the governor would come to dinner at my folks' house. And he would bring like 8 or 9 people that were in the House of Delegates and the Senate. And Dad bought this huge piece of plywood to put on the table to fit everybody. And then Mom was this amazing cook. And she'd make these huge feasts. And then afterwards we'd perform. For that time, it was Mandel was the governor. And
so Tommy D'Alessandro was at your house. Was Pelosi there also? I mean,
yeah. But anyway. And that's why he was sent to San Francisco. Anyway, and so it was funny because Blair Lee was the lieutenant governor. And if Mandel was there, Blair Lee wouldn't come. And if Blair Lee came, Mandel wouldn't come.
Oh, funny.
But it was interesting. And so then, it just kind of, we had a lot of people around us all the time. And the ambassador from so-and-so, Helen Thomas, who was dean of the White House Sports, he'd come to our house for Thanksgiving all the time. And so we've had a really fascinating life.
Absolutely.
So where was your dad teaching? Was he at A High, or where was he teaching?
So we moved here when I was 5. He was a teacher in Coalport, Pennsylvania initially, but he was only making like $2,000 a year in 1962. So he moved down here, and he was at Southern High School in Anne Arundel County.
Okay.
And then he was the director for the state chorus and all that stuff. And then he became a pupil personnel worker, which was somebody that worked with kids with problems and problem kids. Okay. And so that paid a little more. So he gave that up, but he gave up the music teaching after a while. But he was at Southern High School.
So this is with the singing thing. So Steve at our surgery center, his OR day was on Mondays. So I would always follow Steve on Tuesdays, and I don't sing in the OR. I should start to, but I used to always just hear about, Dr. Brown was singing this, Dr. Brown was singing that. And then just last week, I finished a book called Inner Excellence. And one of the things the guys talked about is that if you're trying to focus and increase your focus, singing while you do a complex task is helpful. So I was like, maybe that's what you were doing. That's where you were belting it out, hitting your highest notes as you were tying your rotator cuff knots.
It is funny. I mean, I would sing, and then the people, like at the hospitals, particularly in Anne Arundel, I would have 5 or 6 nurses in the room. They'd be dancing, and we'd have music on. I had great speakers I brought, and people were singing, and the OR was great fun. And if you can't operate and sing and do that stuff at the same time, you're in the wrong business. You need to go do something else.
Yeah.
If you need that. And at the end of the case, you don't even know what songs you did because you've really been focused the whole time.
Yeah.
But I was in the OR one day, and I went into the room next to me to go just to talk to the doc because I had a break. And so I started talking. He's like, "This is a really important part of the operation." He's doing a shoulder scope, for crying out loud. And so I go in there and I said to the nurse, I go, "Is this a joke?" And she goes, "No, this is real." I go, "You're kidding me." And she goes, "No." And I said, "Oh, okay." So I shut up and went back to my room. And like a half hour later, he comes back. He goes, "Sorry, I was putting the anchor in for the subscapularis." I'm like, "Yeah, okay. So I I didn't really understand why you have to have quiet and that stuff. You go like this, you hit 5 times with a mallet and you're done." So anyway, some people need complete quiet. And some people like me and probably Ty have a lot of bantering because, these people are working really hard. You don't get a mulligan in healthcare. There's no such thing as a mulligan. So you better be perfect. And there's no reason these people can't work hard and have fun at the same time because it takes a lot of pressure off them as long as they're doing their job. Now, when you have somebody in the room that doesn't know what they're doing, they're quiet in the room then because you got to keep an eye on them because I don't want any excuses.
Yeah. Yeah.
It's funny because I take that same approach as a patient. One time I was down in your surgery center and I was coming out of a labrum tear surgery. It was a shark attack. We can get into that later. And I was coming out and supposedly I was telling stories about Ty when he was 17 when I came out and he was like, "Dude, you can't say that kind of stuff without me, around." Like, hey, I had the truth serum. I don't know what was going on. I don't know what.
You can get away with a lot.
Yeah.
You can get away with a whole lot.
But people enjoyed me.
So
that's fun.
Did you stay involved in music as you got older? Like,
I played violin for 11 years, and then, we'd sing and perform once in a while, and we sing all the time. And then you sing in the church choir and that stuff. But, Sam had a lot of practice. I'm in med school. George is, Sam's 6 years older than me. Debbie's 4 years older, and George is 3 years younger. So we're all different parts in our life. And Sam and Debbie had this amazing rock and roll band, and they used to play all over the place. And then they always played at the Fine Arts Festival in Annapolis every year. They used to have a Fine Arts Festival, and that was in June. And so they were down at the dock and playing out there, but they were incredibly good. And I remember once we were, where are we singing? I'm trying to remember where it was. We were performing, and, they have these big orchestras out in California, like the Les Brown Band and Orchestra, that played for the Oscars and that kind of stuff. And somebody happened to hear us, and they came up to my sister and offered her to come to L.A. and sing in this band or orchestra, this big 60 thing, that plays for all this stuff. And she was at Towson then, and she turned it down. I'm like, "Debbie, are you crazy? Go. What are you kidding me?" And she turned it down and wound up not going, but she really could. So she and I were the lead singers. She would do the female songs. I'd do the male ones. And then Sam and George basically sang backup. But I have a really high voice. I have a voice that can hit Michael Jackson notes.
Oh, wow.
Even now, after the chemo, it's a teeny bit lower because I had a lot of complications. But I can really hit some high notes.
Awesome.
So besides singing
without crossing my legs.
No. Besides singing in the operating room, what are your other favorite things about being a doctor?
So, there's not much more personal contact and playing a role in somebody's life than being a physician. So I think, first of all, as a physician, you got to learn to respect your craft. That's the most important thing. And what I mean by that is what people do when they walk in your office is they lay themselves bare and make themselves completely vulnerable to you. And you have to respect that. I was a resident, and I'm not going to, so I was at GW, and, there's a lot of very high, powerful politicians in in DC. I'm in clinic, and I'm a PGY3, which is a third-year resident, and out of a 5-year program. Now they're 6 years. But and I open up the door. And I'm not going to say what it was, but one of the cabinet members is standing in front of me in boxer shorts, and a T-shirt. And I remember going, man, this is quite a profession. That very moment, I said, and you have to really respect it. You have one of the most powerful people in the world who has never met me standing in front of me in his underwear. And not that I didn't respect it before that, but man, when that happens, you go, okay, this guy's making himself vulnerable. You really have to honor that. And there's something special about how close you can get to people right away. And making a difference and being thanked. I mean, my brother does a lot of family loss, a lot of divorces. I mean, I can't imagine how many times he gets thanked a week, but it's not a lot. And he would never loses. Ty and I, we get thanked 100 times a day. Literally 100 times a day, people thank us. Now, he and I are similar. We treat people with respect, and we don't think we're better than anybody else. So the nurses and us and the anesthesiologists, we're all the same. We're all just doing different tasks, trying to get to the end point and on the same team. And so I think for me, the chance to affect somebody's life in a positive way. And, the difference in it's really exciting. The difference in what Sam does and what I do, at the end of the day, Sam if he wins, somebody else loses. For Ty and I, if the patient wins, we win. If the patient loses, we lose. So we're tied at the hip. And so for us, it's a much easier lifestyle. When you go home at night, you can rest easily knowing you did everything you could to help that person and affect their life differently. And the big thing for me was I would, I played music in the office all the time, and I had it in the OR. So some of the comments I got were like, when I went out sick, they're like, Dr. Brown, when we go to the office, it's not the same because we could hear you singing in the music, and it puts the patients right at rest. It makes them really comfortable because you're doing something that's kind of fun and jovial. And I'll take requests, and then we can put different things on. And so that's one thing. The second thing that happens is whenever I meet a patient the first time, I really ask them about a lot of personal stuff. And I'll make little notes in the chart. So when they come back the next time, I'm like, oh, how was your vacation here? How's your daughter Sabrina doing with this or that? And so you make a connection with them. You make a real connection, which people don't really get in life. When they leave Sam's office after divorce, they're not calling about to go to dinner. When my daughter Helena, my firstborn, was born, I got 42 Afghans knitted for me by patients. And one showed up a year and a half after she was born, and the woman was a rheumatoid, and she said, Dr. Brown, I have to apologize because of my hands. She didn't see Ty. Because of my hands, it took me a year and a half to knit this. So she spent a year and a half as a gift to me for my daughter. And so I think those things put people at ease. And then I tend to hug people and put my arm around them. And I'm a big believer in touching them, whether you have to touch their knee or somewhere. You have to have that personal contact with them and show that you're interested in their life and interested in their family. And when you do that, you become part of their life. So each one of these patients that comes in, you're sharing their experience with them.
As a layperson, it's refreshing to hear that, right? And I can get that vibe from you, just from talking to you. And I know there wasn't any bullshit in that. That is all real. My question is, did you have a mentor early on that said, hey, here's the way I kind of do it? Or did you watch somebody do it and say, this is the way I want to, pattern my career? Or is it just over time? Or is it that's just the way Steve Brown is? And if Steve Brown was a plumber, he would still be singing and everything like that. And, where does that come from?
I think, one, it comes from who you are. I think your innate personality comes out. Some people that are pains in the ass when they're 15 or pains in the ass when they're 30. I think a lot of it, not that, I don't think Ty and I are arrogant. Really, I'm saying this seriously. But we do have confidence. And if you have confidence in your skills, then it takes a lot of stress off of everybody and you can be more open. For instance, like I never mind somebody getting a second opinion. In fact, I always offer them a second opinion if we're going to do something or whatever, because my feeling is it's only about the patient. This is not about me. And we're only there for them. Once it becomes about me, I need to go do something else because then you're not honoring your profession. And so they would, you get second opinions, you do these other things because you're confident. And if they find that they're connected with that other doctor better, let them stay there. It's okay. I just make sure that it's somebody I trust that they go to. I don't want them going to people that are, in every community, there's going to be physicians that are operating because of money and they're unscrupulous. Whether they're smart or not, I don't necessarily trust them. And I just make sure that where they're going is somebody I trust. And so I think, if you make it about the patient and that the patient knows that they're the priority and you're not, I will tell you that, life is easier. The other thing that's important is the patient has to feel, what's the best way to put this? Not only that they're a priority, but you don't judge them. We're really blessed in our profession. We don't judge anybody. Our job's not to judge them. It's to take care of them. But you have to have a good relationship. So if there's something going on, like with a lot of the illegal aliens that would come in, right away, I'd ask them where they were from, where their town was like, what did they do? What do they miss the most? Because if you get them talking about that, they're going to be at ease. And if they're at ease, then they're going to tell you what's going on. Because, when we examine somebody, we're just corroborating what we already know from the history they gave us. The history is where you figure out what's going on. The exam just kind of corroborates it and makes the patient feel better because you have to put your hands on them and stuff. So I was in the office one day and I was sorry, I might get back pain because I had 18 fractures in my spine. So I keep adjusting this pillow behind me. Sorry. So,
good.
So I was in the office one day and I had a black gentleman come in and he said, so he gets into the room and he's being really angry and belligerent towards me. Now I've never met the guy before, right? So after about 2 minutes, I could already feel the hostility. And I said, are we going to have a problem here? And he said, what do you mean? I said, I can already tell your hostility towards me. I said, I don't know if you've heard something, in which case you wouldn't be here. If it's a racial thing, if it's a personality thing where we're not going to mesh. I said, what is it? We got to get this out of the way if I'm going to get you better. And he said, well, I don't know you from anybody. He said, I don't know whether you're worth me even being here. And I said, we talked for a minute. And I said, well, let me just tell you something. And I said, the way I view it, in med school, we had 5 of us that lived in a house. It was myself and Ray Smith. We were both white. And Bobby and George were both black. And then we had a guy that was a quarter black, quarter Hawaiian, quarter American Indian, and quarter Puerto Rican. So he looked like everybody in the world, right? So I learned a lot by living with those guys, and stuff. And so we were sitting in the office, and I said, when I walk down the street, they go, hey, there goes Steve Brown. When you walk down the street, they go, there's a black man. His name is Joe Black. And he started crying. This big black guy, like big, powerful guy. He starts crying in my office. And he said, I never heard anybody talk like that. He said, where did you learn this? And I said, well, I grew up in a house that was whatever. And my family was not that way. I'm half Lebanese and half Syrian. My dad, when he was a kid, had to ride in the back of the bus in Pittsburgh because he was Syrian, that kind of stuff. So, and I said, living with these guys. And he said, I'm never leaving you. And we had a great relationship. But you got to get that stuff out of the way because right away. If you're going to have a relationship with somebody, they have to be honest with you. And they're never going to be honest if they feel like there's no connection.
Wow.
That's a great story. Now, I have a question. Like a lot of doctors these days are not getting this out. Like you can't open up a journal without them talking about physician burnout and all this kind of stuff.
Right.
And you did not burn out at all. Like
No, I'm ready to go back today.
how did you prevent physician burnout? And also, how would you advise a younger doctor to prevent physician burnout? And how would you choose doctors who are less prone to burnout?
So I think a few things are important. Now, you and I are both blessed in that we were able to come back to communities where we had friends and family. All right. So when you come back, like so I
You
grew
see
up in
what I'm working
Annapolis.
with my friends, right? The guy in the
Right.
center.
Low bar.
Right.
Your friends
So-
are much higher level.
So
He's not wrong.
you know, when you have friends from high school and elementary school that I still hang out with, they're not afraid to call bullshit on you. And they don't let you get away with a bunch of shit, and they don't let you act like you think your shit doesn't stink. And so there's that. Coming back to the community, I would say. Okay. So when you get back, you got family around. If you get into trouble, you have people you can talk to that you trust and love you and have your best interest at heart. And the same thing with your friends. So you're not alone. So from day one, you're not alone, and they're proud that you're there. That's the first thing. So, I mean, that's not something you can always choose, but you and I are blessed in that way. And that you had your dad you could go to too, probably. But so that was really excellent to be able to come back here, which I always wanted to come back. The second thing I will tell you is in our specialty, we change locations a lot. So, I'm not an internal medicine doctor that's in the same office with the same 5 people every day, which after a period of time can wear on you. Yeah. On Monday, I was either at the surgery center in Glen Burnie or I was at BWMC. On Tuesdays, I was in Arnold. Wednesdays, I was at Anne Arundel. Thursday, I was in Glen Burnie. And Friday, I was in Kent Island. So I always had lots of different people around me so that it was interesting. It wasn't, you didn't get like stuck in the mud. So change is really important where you can, you get to talk to different people, you have different relationships with them, and you're looking forward to whoever's going to be in that community that day. And, the music's always on in the office, and it always kind of made it really fun. And then the third thing I think is it was important, like at the beginning of my career, we got reimbursed better than we do now. And then you could make I was right on the cusp when it was a reasonable living. And so that allowed you to take frequent vacations. So every 6 weeks to 2 months, I would take a week off. And by taking a week off, whenever you came back, you always felt like you were a better doctor, like you listened a little better, like you were a little kinder and you were a little nicer. And I think, so that's the other secret. Don't be afraid to take time to be with people you love or enjoy and get away and be yourself again. But, like I was on a couple ball teams when I came back. And so a couple nights a week, I was playing ball with all these buddies I knew my whole life. And then we played basketball in the winter. So we had, there were a lot of things in our life that affirmed me as a human being where I wasn't being judged. And if they needed to call bullshit on me, they weren't afraid to.
I was thinking, sorry to cut you off, but when you made your comment about meeting the member of cabinet, when I remember distinctly, growing up in the 80s, this is when, as a kid, doctors were on this pedestal, right? Everyone kind of like, you're afraid to question, you're afraid to do all this stuff. But then when my 2 best friends became doctors, I was like, wait, they're just idiots just like I am. And so they came down off this pedestal. Right. But it made my relations with doctors a lot better because then you're like, wait a second, I know this guy's a jackass because, I know these other jackasses. And so
you can have a dialogue.
Yeah. And it makes it a lot easier. So Ty, thanks for being the jackass that you've been.
And it's funny. I just realized I think that staying around your friends you grew up with definitely makes you humble because they know you from way back.
Right.
I know that I'm not arrogant about being a doctor. I am arrogant about my 1980s NFL football knowledge.
It is funny, isn't it? Yeah. And they know it's like since I've gotten sick, people have found out, and they show up like all these people from high school or elementary school show up here at the house to check on me and stuff.
Yeah.
And so, when you had hard times, these people from long times ago in your life that really meant something to you, they come back and it's like nothing's changed. My girlfriend from high school, who I haven't seen in 20 years, showed up here 2 weeks ago. And I'm like, Jan, are you okay with this? She goes, yeah, I'm okay. I said, apparently she still looks pretty good.
So the other thing, I saw an article this week that if your friends make fun of you, they are 300 times more loyal. So literally, Matt is the most loyal guy ever. He makes fun of all of his friends.
And he must really love his wife then.
I do. I love them
I'm
all.
sure he makes fun of her all the time.
Yeah.
Yeah, she's done with it. She doesn't laugh as much as Ty does anymore.
So, but it's I think that helps a lot. And plus what we do, you know, if you feel comfortable with what you do, like I used to do a lot of ACLs. You know, I never really loved doing them. And I just one day I go, I'm not doing them anymore. And I didn't do them ever because I wasn't enjoying doing them. And you know, so I did, you know, a lot of shoulder and upper extremity, and I still did lower, you know, because I took care of the bullets and I took care of the caps, and I was a doctor for Virginia Slims, which was the female tennis pro tour. Then I did that.
If you were selecting med students or looking at, you know, talking to young people who are thinking about going to med school, and I like to divide up, you have to have a certain intelligence, right? So
Correct.
You have your book smarts. I think it actually helps a lot to have emotional intelligence, and it helps to have street smarts. And not everybody has all three of those. You can certainly develop them, but do you think that maybe we're only looking at academic intelligence, and maybe we need to kind of look at some of those other factors that are some of your strengths?
Well, first of all, I'd say that's what the interview process is about, being able to figure out who people are. And you and I spend our whole life sizing people up. Not judging them, but sizing them up. So there's really no reason why you can't, after knowing somebody for 5 minutes, knowing what they're all about. And I think a couple things first you look for. One, I'm not big on graduating from high school in 3 years and college in 3 years. You know, because these people, there's a big difference between a 23-year-old and a 21-year-old, or a 24-year-old and a 20. Those people lose, like the people who were in our med school class that did that, they didn't have the same social skills the rest of us had. So you don't want to rush through life. That's the first thing. You know, I mean, I understand a lot of people are smart and they want to get through in 3 years or this or that. But I think that's the first thing. You know, we mature at different times. I mean, the reason that the NFL doesn't take 18-year-old kids is not because they're trying to be kind. It's because the muscle mass, the bone mass, they're just not mature enough because they don't have enough testosterone at that age. And so they're not developed. Well, it's the same thing with your mind and your social skills and your intellect. It's going to develop over time. And I said, so that's one of the first things. The second thing is, I was saying, you know, UVA, we had religion and philosophy majors and, you know, people that were really interesting people and did a lot of stuff. And you look at their resume, it can't be just they had 20 articles published and they volunteered in the OR. It's got to be that they did other things. Like I was a big brother at UVA for a while. I played baseball. After I left baseball, I ran student activities for the university. So, you know, I did a lot of stuff and ran a bunch of things. And so you want somebody that's going to be that has already spent their life engaging with people. And so those are the kind of things you want to look at. I mean, I think it's great that you got published at 20 years old or 18. But I think it's equally as good that, you know, you're in a band or you played on a ball team and you know what teamwork is about, because you have to be able to bury your ego. Because if you can't bury your ego and realize that, you know, you may be better at gamekeeper's thumb than I am. You know, those things that's an injury that a lot of skiers and basketball, I have one on this thumb. But, so anyway, you know, you're going to have failures in life. But you have to be able to overcome them. And if you're not intellectually or really emotionally stable for that, then you know, you're going to be in real trouble.
Yeah.
And so those things really matter, what they've done. And if they're one-dimensional, then that's not so good. And they maybe never dealt with failure.
Yeah.
You know, because they were on that road to do whatever.
And it kind of goes together. If you're one-dimensional, you're going to be more likely to burn out, right?
Right. And those people become pathologists or maybe radiologists or something else because they don't have anything else going on in their life. And it can't be just I go to work, I come home, I see my wife, I see my kids, and I go to bed.
Yeah.
that you're destined to have no life there.
Yeah.
And therefore, you're doing a disservice to your patients. So I think when you're interviewing somebody, you want to see somebody that's smart enough. You want to have somebody that's honest. You can tell if people are bullshitting you.
Yeah.
And, and so you want to hear honesty from them, and you want to see that they've lived their life and that they have a passion for what we do.
Yeah.
It's okay to want to be successful financially and those things, but that's going to come if you do a good job and patients trust you. And they're going to trust you if you're honest and sincere. And again, you have goodness and kindness in you. The first thing is at least you have to care.
Yeah.
You have to have empathy, because we're not going to get everything right. And if there's a mistake, you have to be able to sit with that patient. Not a mistake, but if things don't go well, because we can't guarantee everybody's going to do great. And you have to be able to sit down and say, listen, here's what we did, and here's what we're going to do to fix it. And I'm sorry you're having a hard time, and we can do this, or you can talk to this guy or that guy. You have to have the maturity to be able to do that.
And then with treating athletes, because you've treated athletes at all levels, and we, in our podcast, we have had a lot of conversations with athletes, and sometimes we talk about injuries. What is your secret sauce to the people who really do great coming back and get to their level or even above that level? Like, have you noticed anything over the years?
So I think it's changed drastically, but if you look at that, I think a couple of things before you talk about that is you don't want to treat people differently because they're pro athletes. There's a lot of pressure. I did the bullets for a long time. And then when I stopped doing them is when agents started to have so much power, they started to dictate what you had to do. And this is when people started doctor shopping and started, started making demands, these agents. And the guy that was the main guy was a guy named Steve Haas, who's out of DC. And Steve had this amazing practice. And he was the dream team doctor for basketball in Australia. And he did the caps, he did the bullets, he did GW at Georgetown, and he also did Virginia Slim. So when I was a resident, when I was getting out, he came to me and said, listen, do you want to take care of these teams with me? We're spread thin, and he had a couple partners. And I'm like, sure, who'd be an idiot not to do that? And so we started taking care of him. And he had an episode once where he had stopped taking care of the caps. And because one of the caps had gotten injured, he took him out of the game. The GM came to him and said, he's going back in. And Steve says he's not going back in. He had an MCL strain and a medial-collateral ligament strain, not for you, but for him. And so, and if you have that, the amount of force and the duration of the injury, the force determines what you have. So you get an ACL, you get a medial meniscus, you get a meniscal tear, you get an ACL. It depends how long the force was and the magnitude and duration. And Steve said he's not going back out there. And he said he's going back out there. And Steve says, if you send him out there, I quit as your doctor. And he said he's going back out there. He goes out in the ice, takes 2 steps, and blows his ACL out.
Oh.
So Steve didn't take care of him for a couple of years. So when I was helping him with them, he's like, he told me this story, and he said, do not let people intimidate you. Do not let them, try to get over. These are just people. Treat them like everybody else. And so the first thing with trying to get people back and get better is you got to be honest with where they are, what they're capable of doing. And so you can't have 50 people with their ear. You either have to be in charge of it or let them do something else. I think the other thing is, recovery has been a big deal since, like I was doing the Bayhawks, which is the Major League Lacrosse team here in town.
Yeah.
And we were playing the championship in Boston. This is, 10 years ago, 12 years ago, whatever it was. And we played the semifinals, and it was 100 and some degrees. And so we won. And right afterwards, Milford Marchand, Milford's with MedStar now, he's like, come on, we're going to do this. And he had pulled all these articles on recovery after playing. And we had ice baths for everybody, and we had this and that. We had them on bicycles, and they're exhausted. They're doing all these things that help with recovery, right? So 2 days later, we played the championship, and the other team was actually better than us, and we killed them.
Yeah.
And they came over afterwards and started talking with the players about how exhausted they were and how did our teams be so fresh? How were we able to be so fresh? And the players said, did you do this stuff? And they're like, no, we didn't do any of that stuff.
Yeah.
And they go, yeah, we were bitching the other night when we were laying in ice baths. We wanted to go out to dinner and stuff, but it made them fresh. And so there's so much science now with recovery And you have to really follow that and be amenable to trying those things, you know? Now, with PRP and stem cells, there's all that gets people back faster now, too. You know, if you look at Ray Lewis when he was in the Super Bowl after he blew out his tricep, they did PRP and stem cells on him. That's how he got back. So.
Yeah. Yeah.
So there's a lot of science that's out there, but one, you have to have a patient that's going to listen to you. You can't have an agent that's interfering. And two, you can't be intimidated by these people.
Yeah.
I was covering it was New Jersey against the Bullets one night, and a player who should remain nameless, who's a really famous guy, is on TV all the time. And this is 20 years ago. So I go over, they go, can you come see him? He has no sensation in his hands. I'm like, really? So I go over there and immediately starts cussing at me. And he's like, listen, if you're as shitty a doctor as the Bullets are a basketball team, I don't want you touching me. I said, you know what? You need to go screw yourself because I'm not even touching you. I'm out of here. And I turned around to leave, and he goes, oh, we're out at the bench. And he goes, I'm sorry, Doc. I know, and he starts begging, right? I go, okay. So I look at him, and he's got his ulnar nerve and his median nerve in his hand. He's got sensory deficits in both hands.
Yeah.
And he's got this tape on his wrist. It's really tight. I go to the trainer. I go, give me your scissors. And he goes, okay. I cut the tape. I go, can you feel now? And he goes, yeah. I go, good. Go screw yourself. Bye. And I walked away. So, you know, if you don't have their confidence, you can't, huh?
Wow. Yeah.
Better.
Well, you know, you made a good point, though. You can't be treating people like they're VIPs. Things get messed up when somebody's treated like a VIP.
Exactly.
My dad treated every single high school wrestler, whether they had a winning record or were a losing record. He treated them all like VIPs. He always would say a high school wrestler, he treats them like his own son.
Well, that's different than kowtowing to him.
Yes. Yeah.
Or being impressed with him, you know?
Yeah.
So, I mean, it's a little different. Like, you know, I always used to joke it up and yuck it up. So the first Caps game I did, you know, the Bullet games, you didn't have to work a lot. The Caps, you got to work a lot. Because you're always sewing somebody up and all this stuff. So I'm doing the first game I did with the Caps at the Cap Center. And Stan Long was the trainer then. And so this guy gets all cut up and he's bleeding out of his face and his neck. So we take him back and I'm sewing him up back in the locker room, right? So I'm joking with him, trying to relax him. And I go, Stan, what's going on? This is some of my best stuff. He's not laughing at all. He goes, Dr. Brown, he's Russian. He doesn't speak a word of English. I go, oh, yeah, I felt kind of stupid.
That's awesome.
So that's awesome. So I do want to get into, we don't want to keep you up too late. I want to get into a little bit.
I'm not dead yet. I
want to get into a little bit about you being a patient.
Yeah.
So tell us a little bit about that, or what you're willing to tell us, and
you can know whatever you want. My life's an open book. I'm on the phone all the time with people with multiple myeloma. And so, you know, I've had 3 times where they came in and said I wasn't going to make it through the day. And once I was in New York and they flew everybody in that day to say goodbye to me. You know, people from med school came, and, you know, my wife's family. So it was hard. But I said to him, I remember my sister-in-law came in the room and she's like, you know, what do you say to somebody when you're saying goodbye to them, you know? And I said, you know, Chris, I knew that my arms were all black from the blood. I had DIC. I had something called HLH, which is this immune disease that nobody's ever lived when they've had those two things. Zero chance. They had come in and said, we're going to make you a DNR and we're withdrawing care and there's nothing we can do. You're not going to make it through the day. And I said, what? And he said, yeah, we need your permission. I go, no, you're not withdrawing care. And he said, why? I said, I don't feel that sick. He goes, Steve, you're going to die today. And if I have to intubate you, we're never going to be able to extubate you. So my sister-in-law comes in and she goes, you know, she's saying goodbye. And I said, Chris, I don't really feel like I'm dying today. You know, I mean, like, I'm not going anywhere today. And she goes, really? and they literally, the people were flying into New York, and the doctors up there were amazing. But that's happened 3 times. But I will say that, but I never thought at Christmas this year, I thought that was it. I got out Christmas Eve, and I thought it's the first time I was like, okay, I've had enough, you know. But I will tell you, the most important thing is you need an advocate, and you have to be your own advocate. So what happened with me, I was getting, you know, I had the, whatever you believe in the COVID vaccine, I was perfectly healthy. I got that vaccination. I started getting sick 3 weeks later. And a lot of studies have shown that it decreases the immune system, and people have a lot of underlying cancers in their body, which their body keeps in check. And that M protein that's on the, that's with it seems to lower your immunity. And that COVID vaccination, it looks like, if you look at the cancer work now, really caused a lot of people that have the cancer they were keeping under control, that unmasked it and they went crazy. So it was the fall, and I go to the doctors and I'm like, I think I have cancer. I had a compression fracture, all this stuff. I was having horrible pain, and they're like, Steve, you're fine. This is all from COVID, because I'd had COVID pneumonia. I've had COVID pneumonia 5 times now, and I'd had COVID pneumonia and all this other stuff. And I said, no, I think I have cancer. And he said, Steve, you're just being neurotic. That's not like you. What's wrong? Maybe we'll put you on something, because this is just whatever. I go, fine. So a few weeks later go by, and I go in to see him again. And he's like, well, you're not making antibodies with the COVID vaccination, so something's got to be up. I said, I think I have cancer, and I have multiple myeloma. And he goes, Steve, you're being ridiculous. So he says, all right, I'll have you see an immunologist. So I called up Hemonc doc in Annapolis, who's a really good doc, actually. So I was supposed to have an appointment. It was December 14th. And then he ran over, so he said, you can't be seen today. So this is 2021. And I call him, and I said, no, this is not okay. And he said, Steve, we're going to put you on antidepressants because you're being ridiculous. And I said, look, I am not a stupid man. I have cancer, and I have multiple myeloma, and somebody's going to believe me. And he said, all right, fine. Do you mind if we do a test? I go, mine, I'm begging somebody to believe me. So I go in. He goes, well, if you really had this, you couldn't operate like you're doing. You couldn't work like you're doing. And I said, I think I'm pretty tough. I could do all this stuff. So I go in, and I'd already had some compression fractures. And so I go in the next day, I operate all day, and I go in to get my study, and I go back to see the radiologist. That was at Anne Arundel, and it was supposed to be somebody I knew, and it wasn't. It was a new kid who was really rude to me, really rude, and because he was scared. And I went back there, and I had my scrubs on and my ID, and he goes, can I help you? And I said, yeah, I want to see my study. And he said, are you sure you want to see it? And I said, yes. And he said, what are we looking for? I said, I think I have multiple myeloma, but nobody believes me. And he said, well, you have multiple myeloma. It's through your entire body, and it's really aggressive. And he pulled it up, and I had a pelvis. My left ilium was literally in 2 pieces, and right ilium. So I had 19 fractures at that point, 14 on my spine and everything else. And so the next day I started chemo, and a week and a half later, I was in intensive care at Hopkins, and I had aspergillus, which is a really bad concussion pneumonia. I had aspergillus pneumonia, COVID pneumonia, and bacterial pneumonia. And that's the first time they came in and said, we have nothing to offer you. You're not going to get out of here. I'm like, I think I am. And so what happened was I was going to Hopkins. It turns out Hopkins isn't great for multiple myeloma. Now, my wife's a nurse, you know, Jen, and she started researching, and the number 1 place for multiple myeloma is M.D. Anderson, and number 2 is Sloan Kettering in New York. And I wanted to stay here because I wanted to be near my family. Last year, I was in the hospital for 9 months. From September to September, I was in the hospital 9 months in New York, and that really wore me out. And so I agreed to go up there, and it is the best decision, because I clearly would not be alive if it wasn't for them. I've had 3 transplants. I had an autograft, an allograft, and then this T-cell, which is called CAR T. And the difference they've made saving my life, he's the most amazing doctor. He's the number 1 guy in the country for transplants. His name is Sergio Giralt. But again, if I didn't have an advocate like my wife pushing, I would never have done it. So when you're sick, you need an advocate to fight for you. Almost killed me a few weeks ago at Christmas. And she came in. I called her in the middle of the night. I go, Jen, we're in trouble. And I was crumping, and I had to give my own orders. I had to, like at 3 in, I had to order a chest X-ray, nebs. I had to order antibiotics. I mean, I'm sick. I'm laying in a hospital with COVID and pneumonia and RSV. And it turns out I was in congestive failure. So I was really sick. And she came in and ripped everybody a new one. And they got real nurses in there, and they did this. And so, I mean, you have to have, what I've learned is, one, to say thank you, because people are trying really hard to save your life. 2, to make sure that you have an advocate, but you have to relieve that advocate. My wife is killing herself. She needs a break. And so things have calmed down a little bit. You know, they gave me, in August, I had peritoneal mets, I had liver mets, I had peritoneal study, and I had 6 mets in my lungs, and it was everywhere. And they did this CAR T, and within 10 days, I had bilateral drop feet. I couldn't walk. Within 10 days, I could walk again, and the tumors had disappeared in 10 days after they did this procedure on me.
Wow.
And it was all through every bone. The only bones that didn't have mets in them were the tibias bilaterally. And the pain it's like pain I never knew. And she fought for me and got me so that I'm still here today along with the doc. But you have to be able to relieve that person that's your advocate, because it's too much for them.
Yeah.
You know?
So the one thing that sticks out in my mind, and I don't remember, we had a conversation at the surgery center. You had been diagnosed. You were laughing because you got so short because of all the fractures.
I lost 5 inches in 2 months.
And you were coming from the office and like doing a rotator cuff or something. But you told me the percentage of what your chance of survival was. This was before the first bone marrow transplant. And I was kind of like, well, how come you just don't go to a beach or something? And you were like, you know what? The kids have to do school. The girls are at college, and ultimately I can't just sit around feeling sorry for myself. And I love working. And I got to think that your positive attitude, your strong family, loving what you do is why you're still here talking to us today. That I doubt other people would have survived.
They came to me, like when I was there last month up at Sloan, who were the nicest people and the most amazing nurses and doctors. And they said, why are you still alive? We can't believe you're even here. And I said, well, that doesn't make me feel great. And he goes, Steve, it's a miracle you're alive. We don't understand it. And I said, I don't know what to tell you. I'm fighting. I've had some real setbacks. And they said, in June when I was really sick, they're like, we don't know how you survived that. Nobody's ever survived it. But I have a lot of people praying for me too. I mean, people pray for me constantly.
Yeah.
And I have a lot to live for. You know, my kids need to see me go to work. Yeah. They don't need to see me laying around being a slug. And I try to do better. It's hard sometimes. You know, I try to laugh and be thankful because, my kids don't have it, thank God. And that's the key. I want them to be okay. And I told him a couple months ago, I said, listen, if there's anything experimental that you think is not going to help me, but it's going to help somebody else and you'll get information, you can go ahead and do it to me. Because if I'm on my way out, then I need to help somebody on the way. If it allows somebody to be with their family one more day, then you do it to me. Because I'm here because somebody had stuff done to them. And so when I was there about a month ago, I said, have you learned anything? He said, Steve, we've learned so much. Like they're already writing the paper on me. And I said, look, here's a good picture before I looked like I was going to die, And he said, so for instance, the last treatment I got, the CAR T, is $550,000.50. That's what it cost. Uh-huh. And when they harvest your T cells, you have to have 2,000 T cells per whatever. So T cells are the cells that disappear when you have AIDS. So you have B cells and T cells. And so they harvest your T cells, then they take them to a lab in Jersey and they take them and grow them, do basically make antibodies against your tumor. So what they do is they have to have 2,000. I only had 1,900. So I didn't fit the criteria for the treatment. And they never treat anybody less than 2,000. Well, he called Janssen and they agreed to do the whole thing for free. And so they take the T cells, they take your tumor, and they take your antigenic site, which is like, if you think about it, like, how much medicine do you know? Do you know a lot of medicine at all?
No, but I'm learning.
So if you think about the lunar, when they go to the moon, you have the lunar modules here and the spacecraft's here, and it comes in and hooks in, and there's a mechanism to lock it in.
Yep.
That's what happens with an antigenic site, which is a receptor site on a tumor cell, and the antibody, which is how you kill it. And so that antibody goes in and locks in. Well, with lymphoma and leukemia, CAR T can be curative. It can cure people with leukemia and lymphoma because they have a common antigenic site. It's called CD19. Multiple myeloma, not everybody has the same antigenic site, so the receptor. So they have to take it, and that's why it's not as curative for them. And so they'll eventually find one, but right now they don't know one. And so they took those T cells, made antibodies against my tumor, and gave it to me. And literally in 10 days, I'd stopped taking pain meds and everything, and I was able to walk, and all the tumors were gone 10 days after they gave me the treatment. Now they're going to come back. So my treatment, nobody's ever lived with my cancer. And there's 3 kinds. One you die in 4 months, one you die in 3 years, and one you die in 20 years. I have the 3-year one. And so, and they do that by the DNA of the tumor. But, they're learning stuff all the time. So, what the heck?
You have the 3-year one, but you've gone 5.
No, I've been 3.5.
3.5. Okay.
So how do you make each day valuable now?
Well, you get every day. I always thought that every day I lived anyway. I didn't just exist.
Uh-huh.
I'm a big believer, and that's what I would tell patients in the OR if it wasn't an emergency. And, a lot of what we do is elective, that, but some stuff's not, like fracture care and other stuff. But I would tell them, I would say, listen, you're here to live and not exist. So if you're existing, you need to have it done. If you're not if you're living your life and you can do whatever you want, and it's kind of a nuisance, then maybe you don't do it, because I can't guarantee that we're going to make you better. And so I would go through that. So for me, I try every day to live, and I try to make sure people know I love them. And I have people showing up all the time. One of my buddies from residency comes once a month for a week. He lives in Washington State. He flies out to visit me for a week.
Wow.
And
that's
and I have friends that come to walk with me every day, and other ones that do this and that. And so I've been really blessed with, they say if you have enough friends to count on one hand, that's a good blessing. Let me just tell you, I got way more than that. And they've all really been there. And I have amazing siblings who at Christmas, when I wanted to, I kind of at Christmas, I'm like, I had enough. And I'm like, I wanted them to withdraw care from me. That's the first time that ever happened, but it was so bad. I've been through so much and I couldn't take it. And my one brother's like, listen, you can't die at Christmas. My other brother's yelling at me, put your boots on and cut this shit out and get on there and start working again.
Loyal.
Like,
That's
Sam's
loyalty.
Sam's like, my other brother's like, Steve, you can't die at Christmas. I go, Sam, I'm so tired. I just can't do it anymore. But you don't realize at that moment the death is final, man. You don't get a mulligan on that either.
Yeah.
So I got back, got to work, and got better, and got out in another 4 days. So, we'll see what happens. I like I said, I have a lot of people I'm dying to get to, not dying, wrong phrase, but to get to my kids' graduation. They graduate from high school in a year and a half.
Okay.
And because they're juniors. So the kids are 25, 23, and 17. So I have lots of reasons to live, but I've been really blessed with amazing care. And these doctors, I can't, they treat me the way I pray that I treated other people.
Yeah.
With kindness and goodness, and with using that knowledge and knowing that I did everything I could to help them. And Sergio, when I was in the hospital at Christmas and I was telling them what they needed to do to save me, so he called them. He was on vacation because it was Christmas, and he called them. And he was on speakerphone yelling at these docs. They wouldn't do it. He's like, you got to do this, this, and this. Well, we don't think he has that. He's like, do you not understand? This guy has multiple myeloma. When he gets this and this happens, this and that. And they're like, well, we look. He's like, oh, I'm not asking you. You're going to do these things right now. And they did them, and I lived. But, they just didn't know. And he had called them in the middle. Jen had called him up. He gave us, I have all his numbers and his family's numbers. And he saved my life again.
That's amazing.
So how do you repay that? You repay it by making sure you help somebody else.
You've paid it forward a lot already.
My story is not unique across the country with people after COVID. And we're in unmasked cancers and people telling doctors, I have this and this, and them not believing them.
Yeah.
So, I've been really blessed. And I think, I don't know, my mom died 2.5 years ago, and I guess 3 years now, but she didn't know I had cancer. I never told her I disappeared for a while, and she must have thought it was odd that I wasn't around because I was in the hospital and all this kind of stuff. But I didn't see the need to tell her I was so sick,
Yeah. Now, do you lean on your faith at all?
Oh yeah, I'm a pretty religious guy. And so I'm really blessed. The people at church have been amazing, and they show up and bring food all the time. And like when so it's been great, really. And so yes, I'm fairly religious, and I feel really blessed that I've been able to even stay. Not everybody gets to stay. You think about how blessed you really are.
Yeah.
Look at these poor people in Ukraine and what they're going through there.
Yeah.
People losing family members all the time. So for me, the religion matters a lot, and it's what's in your heart, and you just feel blessed for what you have. And, like I said, the kindness that people have shown us. Like Stephen was playing baseball at Severn, and the 1 year when I had the transplant, every night the parents because Giselle and Stephen were here living alone, believe it or not. And Jen was up in New York with me, and the parents on the baseball team made them dinner every night. And there was a thing on the side of the house, and they dropped dinner off. And then the neighbors, when I came home, every night people dropped food off and did this and that. And I'll tell you a story. So 2 years ago, when they knew I was going to need the CAR T, and insurance wouldn't cover me until I failed a certain amount of protocols. Well, I failed 9. There's no protocols left. And so I'm sitting in the office, and they said, Dr. Brown, you don't quite look the same. And I said, well, I don't care if they know. And I go, well, I hadn't seen this patient in like 2 years. And I was explaining, and they said, what do you have next? I said, I may have this, but it's $550,000. And so we'll see what happens. And I said, because insurance wants me to wait a little longer to get even sicker. And the guy looks at his wife who's sitting there. He's like 75 years old. He said, Dr. Brown, you've always gotten my family and myself well. You've taken really good care of us. I have $5 million. And he said, what's the difference between $4.5 million and $5 million? He said, I'll pay for your CAR T.
Oh, man.
So, I'm like, I can't. I hadn't seen the guy in like 2 years, but I've taken care of him for years. I'm like, nah. I said, nah, I can't do that. And he said, no, we'll pay for this. And his wife is sitting there. She said, Dr. Brown, we don't need the money. What are we going to do? Die with it? It doesn't matter. And so that day I get home, and I get a call from I have a lot of dental friends in town. They were I grew up with them, and they became dentists. And they put 10 dentists together, and they were all given $50,000 each, and they were going to give me $500,000. And then so I got a call from somebody else that offered me $200,000, and then I was like, and my secretary says, Dr. Brown, if you took the money, you wouldn't have to work so hard, and you could have some peace and be home with your family. I said, no, it's kind enough that they've offered this. It freaked me out, really. People just offered all this money to me.
Yeah.
And I'm like, no, I'm not broke. I can whatever. And they're like, no, let us do this for you. So, I don't know, but it was, that kindness that people have done for me. It's crazy. How do you even say thank you?
No idea.
I think the kindness that you've given people in 60 years of life comes back.
Yeah.
Back. So
yeah, I think there is something for that, whether it's with me or not, who knows? But I think I think a life well lived clearly is worth it in the end. I mean, I think it's worth it all along, don't get me wrong, because it brings you joy when you're kind to other people. You know what? I mean, it was funny, you know, we were in the office one day, and I had a new secretary, and I tried to explain to her, you know, people don't come to us because they feel great and they have nothing better to do. And I said, you have to assume that they have real pain, that they have this, they have that, and this is the way I want these people treated. So she's working for me for 2 weeks. And she comes back, and I was in the Arnold office, and she said, Dr. Brown, I just hung up on somebody. I go, what do you mean you hung up on somebody? And she said, well, this person called me, and they wanted to get in, and they were rude to me, and I didn't want to take it anymore, so I hung up. I said, did they cuss at you? Because if they cuss, that's it. You get rid of them, you know. And she goes, no, but they were not very polite. I said, all right, do you have any idea what happened to that person today? And she said, no. I said, you don't know if somebody died, if somebody's sick, if something's going on. I said, you pick up the phone and you call them back and apologize. And she said, okay. So she came back 10 minutes later and she said, I called them up and he said, I was just getting ready to call you to apologize. My dad had a stroke this morning. He's in the hospital and I'm really not acting like myself.
Yeah.
And I said, see? And you know, people don't act like that because of no reason. And we're here to relieve that pain for them. And you know, it's just the way it is. And it's a gift to be able to at least take some pain away from people.
Yeah. Well, usually we have a bunch of silly questions to end with, but I think we need to end on something powerful like that.
Yeah. Yeah.
This was amazing. I feel like I learned even more listening to it.
You and me both.
Yeah. So thank you for doing this with us.
Steve, thank you for sharing that. I mean, that was powerful and moving, and I'm blessed to experience that from you directly. So thank you.
Somebody gets something out of it, but it was great fun seeing you guys and talking to you. And give me a holler. I got plenty of time if you want to hang out.
Yeah,
we'll get some dinner.
Yeah.
My daughter's working at Parlay down on State Circle, so we can always go there.
Awesome.
You guys been there?
Oh,
it's amazing.
Is it a restaurant?
It's a restaurant bar. It's not very good, but they have great food, and it's really easy. And I know the bartender.
Okay. There you go, even better.
Yeah. And then we'll get our technology improved, and we'll do an in-person podcast.
Oh yeah, I'm surprised when you said TV. I'm like, what?
Yeah,
I would look better, you know.
Yeah, no, you look great. And like we said, we love the mustache.
Yeah, man.
Like I said, but we'll see. We'll see. I'm kind of like on it.
Thank you.
Wow.
We learned a lot.
Thank you so much.
We will keep you in our prayers.
Absolutely.
Love you guys.
All right, love you. Good luck.
Thanks.
Thank you.
Bye.